Question 1. Question on anatomy and physiology. Which of the following accurately describes the function of the cardiovascular system? A. It provides oxygen and nutrients to body tissues and removes waste products. B. It controls and coordinates body functions via electrical impulses. C. It absorbs nutrients from the gastrointestinal tract. D. It regulates body temperature and fluid balance. Answer A. Explanation. The cardiovascular system is responsible for the transportation of oxygen, nutrients, hormones, and waste products throughout the body via the blood vessels. The heart pumps blood through arteries, veins, and capillaries, ensuring that tissues receive the necessary nutrients and oxygen, while waste products like carbon dioxide are carried to the lungs for exhalation and kidneys for excretion. Option B refers to the nervous system, not the cardiovascular system. Option C refers to the digestive system, responsible for nutrient absorption. Option D refers to body regulation, which involves multiple systems, including the circulatory system, but this is more directly related to fluid balance and temperature regulation in a broader sense. Question 2. Scenario-based question on patient interaction and communication. Dr. Susan has just finished her examination of Mrs. Thompson, a 45-year-old patient diagnosed with type 2 diabetes. During the consultation, Mrs. Thompson is visibly upset and anxious about her diagnosis. She expresses feelings of frustration about having to make lifestyle changes and is concerned about managing her blood sugar levels. What can Dr. Susan do to best address Mrs. Thompson's emotional state? A. Provide information on the lifestyle changes without addressing the emotional aspects. B. Acknowledge Mrs. Thompson's concerns, validate her feelings, and offer support to discuss her treatment plan. C. Tell Mrs. Thompson not to worry about her emotions and focus on the medical facts. D. Advise Mrs. Thompson to seek therapy immediately for her emotional distress. Answer B. Explanation. In situations like this, it is important to acknowledge and validate the patient's emotions. Empathy and active listening are crucial in helping the patient feel heard and supported, especially when managing chronic conditions like diabetes. By acknowledging her concerns and validating her feelings, Dr. Susan establishes a trusting rapport which can lead to a better understanding and acceptance of the treatment plan. Option A ignores the emotional aspect, which can worsen patient anxiety. Option C disregards the patient's emotional needs and may lead to the patient feeling dismissed. Option D, while therapy can be helpful, suggesting it immediately without assessing the emotional state may be premature and not focused on providing immediate emotional support. Question 3. Question on medical terminology. What does the medical term tachycardia refer to? A condition where the heart rate is abnormally slow. B, a condition where the heart rate is abnormally fast. C, an abnormal heart rhythm. D, a condition where the heart is enlarged. Answer B, explanation. Tachycardia is derived from the Greek words tachy, meaning fast, and cardia, meaning heart. Therefore, tachycardia refers to an abnormally fast heart rate, typically defined as a heart rate exceeding 100 beats per minute in adults at rest. Option A refers to bradycardia, which is an abnormally slow heart rate. Option C refers to a arrhythmia, which is an irregular heartbeat, not necessarily fast. Option D refers to cardiomegaly, which is an enlargement of the heart. Question 4. Question on clinical procedures. You are preparing to perform venipuncture on a patient for a blood draw. The patient is anxious about the procedure and expresses concerns about possible pain and bruising. What steps should you take to ensure that the procedure is done safely and with the least discomfort for the patient? A. Explain the procedure to the patient, reassure them, and choose the most accessible vein. B. Perform the venipuncture without explaining the procedure to save time. C. Choose a vein with the highest potential for causing discomfort to ensure a more accurate blood sample. D. Perform the venipuncture as quickly as possible to minimize the time the needle is in the patient's vein. Answer A. Explanation. Before performing any procedure, especially one that may cause anxiety or discomfort, it is essential to explain the procedure to the patient. This allows the patient to feel informed and less anxious. Reassuring the patient can help alleviate their fears. Choosing the most accessible vein, typically in the antecubital fossa, minimizes the discomfort. Providing proper positioning and using a needle that matches the patient's vein size ensures the procedure is performed safely and with minimal discomfort. Option B is incorrect because failing to explain the procedure can increase the patient's anxiety and discomfort. Option C, intentionally causing discomfort is unethical and unnecessary. Option D is incorrect, as rushing the procedure can increase the chance of complications such as hematoma or incorrect sample collection. Question 5. Question on pharmacology. A 60-year-old male patient has been prescribed an antihypertensive medication, losartan, to manage his high blood pressure. The patient reports feeling lightheaded and dizzy, especially when standing up quickly. What should you do to address this side effect and ensure patient safety? A. Advise the patient to continue taking the medication as prescribed without any changes. B. Suggest that the patient drink more water to relieve the dizziness. C. Inform the physician of the side effect to determine if an alternative medication is needed. D. Recommend that the patient stop taking the medication immediately. Answer C. Explanation. Losartan, an angiotensin receptor blocker arm, can cause dizziness or lightheadedness due to a decrease in blood pressure, especially when standing up quickly, or orthostatic hypotension. This side effect should be reported to the physician for further evaluation. The physician may decide to adjust the dosage or consider a different antihypertensive medication if necessary. Option A is incorrect because ignoring the side effect without intervention could compromise the patient's safety. Option B, while staying hydrated is important, it does not directly address the underlying cause of dizziness. Option D, stopping the medication immediately without consulting the physician can be harmful, as uncontrolled hypertension may lead to serious health risks. Question 6. Scenario-based question on legal and regulatory issues. Mr. Smith, a medical assistant, is working in a medical practice where he has access to the electronic health record (EHR) system. One day, he notices that a colleague, Mrs. Harris, is looking at patient records that she is not assigned to and accessing sensitive information. Mr. Smith is concerned about potential violations of patient privacy. What should Mr. Smith do? Situation: A. Ignore the situation as it may not be a serious issue. B. Confront Mrs. Harris directly about her actions and ask her to stop. C. Report the incident to the supervisor or designated privacy officer to ensure compliance with HIPAA regulations. D. Warn other staff members about Mrs. Harris's actions without reporting the incident. Answer C. Explanation. Under the Health Insurance Portability and Accountability Act, HIPAA, it is critical to maintain the confidentiality and privacy of patient information. Mr. Smith has observed a potential violation of HIPAA regulations by Mrs. Harris, who is accessing patient records without a legitimate reason. In this situation, the appropriate course of action is to report the incident to a supervisor or privacy officer who investigate the matter and take appropriate steps to ensure compliance with the law. Option A is incorrect because HIPAA violations must always be addressed promptly to avoid serious legal consequences. Option B, confronting Mrs. Harris directly, could lead to a conflict and may not resolve the situation appropriately. Option D, warning others without reporting the incident would not address the violation and could potentially expose Mr. Smith to liability for failing to take appropriate action. Question 7. Question on microbiology and lab tests. A medical assistant is collecting a throat swab for a culture to test for Streptococcus strep throat. The proper procedure involves using a sterile swab to obtain a sample from the back of the throat, avoiding contact with the tongue, gums, or teeth. After obtaining the sample, what should the medical assistant do next? A. Place the swab directly into a sterile transport medium and label it with the patient's information. B. Immediately dispose of the swab in a biohazard waste container. C. Wash hands before placing the swab into the transport medium. D. Leave the swab outside of the transport medium until it reaches the laboratory. Answer A. Explanation. After collecting the throat swab, it is crucial to place it immediately into a sterile transport medium to preserve the sample for lab testing. Labeling the sample with the patient's information ensures proper identification and prevents mix-ups. This step is part of proper specimen handling, which is vital to ensure that laboratory results are accurate and reliable. Option B is incorrect because the swab should not be discarded immediately. It must be transported to the laboratory for testing. Option C, while washing hands is always essential for infection control. The key action after collecting the sample is to ensure the sample is placed in transport medium. Option D, leaving the swab outside of the transport medium risks contamination and degradation of the sample. Question 8. Question on administrative and office skills. A medical assistant is tasked with scheduling an appointment for a patient who requires a routine physical exam. The medical assistant needs to make sure that the appointment is scheduled at a convenient time for the patient, and that all necessary paperwork and medical records are ready for the visit. Which of the following steps should the medical assistant take to ensure the appointment is scheduled correctly? A. Check the physician's availability, schedule the patient, and request that the patient arrive at least 30 minutes early for paperwork. B. Schedule the patient for the earliest available time slot without considering their preferences. C. Confirm the patient's appointment only a day before the scheduled visit to ensure the patient is still available. D. Schedule the patient without checking if the necessary medical records or paperwork are ready. Answer: A. Explanation. To ensure that the appointment goes smoothly, the medical assistant should check the physician's availability while also considering the patient's preferences. By requesting the patient to arrive 30 minutes early, the medical assistant allows time for any necessary paperwork or updates to the medical record. This helps avoid delays during the appointment and ensures that the physician has all relevant information available. Option B is incorrect because failing to consider the patient's preferences could result in a missed appointment or dissatisfaction. Option C is incorrect because confirming appointments too late could result in missed or forgotten visits. Option D is incorrect because it is important to ensure that all necessary documents and records are available prior to the appointment to provide the best care. Question 9. Question on infection control. You are preparing to clean and disinfect a surface in the exam room. The surface is contaminated with blood, and you need to follow proper infection control procedures. Which of the following actions should you take to ensure that the surface is cleaned and disinfected correctly? A. Use a disinfectant with proven efficacy against blood-borne pathogens and follow the manufacturer's instructions for use. B. Wipe the surface with a damp cloth to remove any visible blood without using a disinfectant. C. Use a general cleaning solution without considering the specific pathogens that may be present. D. Discard any cleaning supplies after one use to ensure no contamination. Answer: A. Explanation. To properly clean and disinfect surfaces contaminated with blood, it is essential to use a disinfectant that is effective against blood-borne pathogens, such as those outlined by OSHA's blood-borne pathogens standard. The medical assistant should follow the manufacturer's instructions for the disinfectant to ensure it is used effectively. This procedure helps minimize the risk of infection and ensures safe environment for both staff and patients. Option B is incorrect because simply wiping the surface with damp cloth does not ensure proper disinfection. Option C is incorrect because general cleaning solution may not be effective against blood-borne pathogens. Option D is incorrect because cleaning supplies can be reused if properly disinfected. However, single-use disposable items are appropriate for high-risk areas. Question 10. Question on patient communication. A 45-year-old male patient is visiting the clinic for a routine checkup. During the appointment, the patient mentions that he is feeling stressed due to personal issues at home and at work. As a medical assistant, how should you handle this situation? A. Acknowledge the patient's feelings and provide resources for mental health support while maintaining professional demeanor. B. Encourage the patient to focus solely on the physical exam and not discuss personal issues. C. Suggest that the patient consider medication to manage stress without referring to specialists. D. Dismiss the patient's concerns as they are unrelated to the medical appointment. Answer: A. Explanation. As a medical assistant, it is important to acknowledge and empathize with a patient's concerns while it is outside of your scope to provide therapy, offering resources for mental health support, such as a referral to a counselor or mental health services, is a compassionate and professional response. Option B is incorrect because addressing the patient's emotional and mental well-being is part of comprehensive care. Option C is incorrect because recommending medication without a proper medical assessment is outside the scope of a medical assistant's duties. Option D is incorrect as dismissing the patient's concerns could harm the therapeutic relationship and ignore potential underlying health issues. Question 11. Question on medical terminology. A patient presents with symptoms of shortness of breath, chest pain, and dizziness. The physician suspects a myocardial infarction. Which of the following terms would you use to document this condition in the patient's medical record? A. Angina pectoris. B. Cardiomyopathy. C. Myocardial infarction. D. Atherosclerosis. Answer: C. Explanation. Myocardial infarction, commonly known as a heart attack, occurs when there is a blockage in one or more of the coronary arteries leading to damage of the heart muscle. Symptoms such as chest pain, shortness of breath, and dizziness are characteristic of my. Option A is incorrect because angina pectoris refers to chest pain caused by reduced blood flow to the heart, not a heart attack. Option B is incorrect because cardiomyopathy refers to diseases of the heart muscle, not a heart attack. Option D is incorrect because atherosclerosis refers to the buildup of plaque in the arteries, which can lead to heart attack but is not itself a heart attack. Question 12. Question on laboratory procedures. You are performing a routine urinalysis for a patient. After obtaining the urine sample, you notice that the specimen is cloudy. Based on this finding, what should you do next? A. Record the cloudy appearance and continue with the urinalysis procedure. B. Discard the sample and ask the patient to provide another one. C. Immediately report the cloudy specimen to the physician as it may indicate an infection or other condition. D. Ignore the cloudiness as it is a common occurrence in urinalysis. Answer C. Explanation. Cloudiness in a urine sample can indicate the presence of bacteria, white blood cells, or other substances which may suggest an infection or other underlying condition. It is important to report this finding to the physician for further evaluation and to ensure appropriate follow-up care for the patient. Option A is incorrect because cloudiness in a urine sample should not be ignored and requires further evaluation. Option B is incorrect unless the sample is contaminated or otherwise unusable, but cloudiness in itself warrants reporting, not discarding. Option D is incorrect as cloudiness is not a normal finding in urinalysis and should be assessed further. Question 13. Question on HIPAA compliance. A medical assistant overhears a conversation in the break room where a coworker is discussing a patient's diagnosis in detail. This conversation occurs in a public space and the patient's information is shared without their consent. What should the medical assistant do in response to this violation of patient confidentiality? A. Ignore the situation as it is not directly impacting the patient's care. B. Speak to the coworker privately to remind them of patient confidentiality and report the incident to the supervisor. C. Join the conversation and offer additional information about the patient to clarify the situation. D. Discuss the incident with other coworkers to ensure everyone is aware of the violation. Answer B. Explanation. It is essential to maintain patient confidentiality at all times as outlined by the Health Insurance Portability and Accountability Act (HIPAA). If a breach of confidentiality is overheard, it should be addressed immediately. Speaking to the coworker privately and reporting the incident to the supervisor ensures that the matter is handled appropriately and that steps are taken to prevent future violations. Option A is incorrect because ignoring a confidentiality violation could result in legal consequences and further breaches. Option C is incorrect because engaging in the conversation further would violate confidentiality. Option D is incorrect because discussing the incident with coworkers would spread confidential information further, which is a violation of HIPAA. Question 14. Question on emergency procedures. A patient in the waiting room suddenly collapses and you suspect they are having a seizure. As a medical assistant, what is your first course of action? A. Call for help. Ensure the patient's safety by moving nearby objects and prepare to provide first aid if necessary. B. Immediately administer CPR without assessing the patient's condition. C. Rush to the patient and try to restrain their movements to prevent injury. D. Leave the patient and inform the physician about the incident. Answer A. Explanation. In an emergency situation such as when a patient is having a seizure, the first priority is to ensure the patient's safety. This includes calling for medical help, moving dangerous objects away from the patient, and being prepared to administer first aid if needed. Restraining the patient or leaving them unattended can cause harm. Option B is incorrect because CPR is not indicated during a seizure unless the patient stops breathing. Option C is incorrect because restraining the patient could lead to injury. Option D is incorrect because immediate action is needed and leaving the patient unattended would be inappropriate. Question 15. Question on patient intake. During a patient intake, you ask a 60-year-old female patient if she has any allergies. She responds by saying she is allergic to penicillin. What should you do next? A. Record the allergy in the patient's medical record and alert the physician immediately. B. Ask the patient to provide more details about the allergy and document it for future reference. C. Ignore the allergy as it is not relevant to the current visit. D. Only record the allergy if the patient has a documented history of a reaction. Answer B. Explanation. When a patient reports an allergy, it is important to gather more detailed information about the nature of the allergy, G. Type of reaction, severity, and document it thoroughly in the medical record. This information will be critical to ensure the patient is not prescribed penicillin or any related medications. Option A is partially correct, but it misses the step of gathering more details about the allergy. Option C is incorrect because an allergy to penicillin is important information that should be documented and communicated to the physician. Option D is incorrect because even if there is no prior documentation, the allergy must still be recorded and confirmed with the patient. Question 16. Question on medication administration. A physician prescribes a medication to be administered to a patient via intramuscular IM injection. As a medical assistant, you need to ensure the injection is performed correctly. Which of the following is an important consideration when administering an IM injection? A. Select the injection site based on the patient's body mass and the type of medication being administered. B. Inject the medication at 45-degree angle to the skin for optimal absorption. C. Use smaller needle to minimize patient discomfort, regardless of the medication's viscosity. D. Administer the injection into the deltoid muscle for all patients, regardless of age or size. Answer A. Explanation. When administering an IM injection, it's important to select the correct injection site based on the patient's body mass and the type of medication. Common sites for IM injections include the deltoid, vastus lateralis, or ventrogluteal muscles. The choice of needle size and angle depends on the medication and patient characteristics. Option B is incorrect because IM injections are typically administered at 90-degree angle, not 45 degrees. Option C is incorrect because the needle size should be chosen based on the viscosity of the medication, not just for comfort. Option D is incorrect because the deltoid may not be the best site for larger doses or certain medications, and it may not be appropriate for children or patients with insufficient muscle mass. Question 17. Question on infection control procedures. You are working in a medical office and a patient who is known to have a respiratory infection comes in for an appointment. What infection control practices should you implement to protect yourself and other patients from potential exposure? A. Provide the patient with a mask to wear and ensure they are seated away from others in the waiting area. B. Ask the patient to leave the office immediately and reschedule the appointment for another time. C. Disinfect the entire office before seeing any other patients. D. Allow the patient to sit in the general waiting area without any special precautions, as the infection is not highly contagious. Answer A. Explanation. To minimize the risk of exposure the patient with a respiratory infection should be provided with a mask to wear, and they should be seated away from other patients in the waiting area. This helps reduce the transmission of respiratory droplets. It is important to implement these infection control practices to ensure the safety of other patients and staff members. Option B is incorrect because rescheduling the appointment may not be necessary unless the patient's symptoms are severe, but infection control measures should still be followed. Option C is unnecessary unless the infection has spread significantly, and cleaning should focus on high-touch areas. Option D is incorrect because respiratory infections can be contagious and require precautions to prevent the spread. Question 18. Question on handling patient complaints. A patient expresses dissatisfaction with their recent visit, stating that they had to wait an extended time to see the physician. How should you handle this complaint as a medical assistant? A. Apologize for the wait. Acknowledge their frustration and inform the physician of the complaint so they can address it. B. Dismiss the patient's complaint as the wait was beyond your control and move on to the next task. C. Tell the patient that such delays are normal and that there is nothing that can be done. D. Explain to the patient that they should have arrived earlier to avoid delays. Answer A. Explanation. It is important to acknowledge the patient's frustration, apologize for the delay, and take their complaint seriously. Informing the physician about the complaint ensures that it is addressed properly. A compassionate and professional response helps maintain a positive relationship with the patient. Option B is incorrect because dismissing the patient's complaint can cause dissatisfaction and damage the trust between the patient and healthcare provider. Option C is incorrect because explaining delays as unavoidable without offering solution may frustrate the patient further. Option D is incorrect because blaming the patient for the delay is unprofessional and will likely escalate the situation. Question 19. Question on patient confidentiality. A medical assistant overhears a conversation between two physicians in the break room where they are discussing a patient's medical history and diagnosis in detail. The conversation is happening in public area and other staff members are present. What should the medical assistant do in this situation? A. Ignore the situation as it is routine discussion between the physicians. B. Politely ask the physicians to speak privately and report the breach of confidentiality to supervisor. C. Join the conversation to ensure accurate information is being shared. D. Inform the patient about the conversation so they are aware of the breach. Answer B. Explanation. Patient confidentiality is critical in healthcare, and discussing private medical information in a public area constitutes a breach of confidentiality. The medical assistant should politely ask the physicians to move the conversation to a private setting and report the incident to a supervisor to prevent future breaches. Option A is incorrect because it ignores the importance of maintaining confidentiality in healthcare settings. Option C is incorrect because joining the conversation could further violate confidentiality. Option D is incorrect as informing the patient is not the best immediate course of action. Reporting the incident to a supervisor ensures appropriate actions are taken. Question 20. Question on medical billing and coding. You are processing a patient's insurance claim for recent procedure. The procedure was completed, but the patient's insurance company is requesting additional documentation to support the claim. What should you do next? A. Contact the physician to request additional documentation or clarification needed for the claim. B. Submit the claim without any additional documentation as the procedure was performed. C. Inform the patient that the insurance company is refusing to pay and ask them to cover the cost. D. Ignore the request from the insurance company as they often request unnecessary documentation. Answer A. Explanation. In medical billing and coding, it is essential to ensure that all required documentation is provided to the insurance company to support the claim. Contacting the physician to obtain the necessary information ensures the claim can be processed without delays or denials. Option B is incorrect because submitting the claim without additional documentation could lead to a claim denial. Option C is incorrect as it places an unfair burden on the patient, and the office should follow proper procedures to resolve the issue with the insurance company. Option D is incorrect because ignoring the request can result in denied claims and payment delays. Question 21. Question on emergency response. You are working in a busy clinic when a patient suddenly collapses in the waiting area. The patient is unresponsive and their pulse is weak. What should you do first? A. Begin CPR immediately and call for assistance. B. Leave the patient to notify the physician about the collapse. C. Check the patient's breathing and pulse before proceeding with any interventions. D. Place the patient in recovery position and wait for emergency responders. Answer A. Explanation. In an emergency situation like a collapse, the first priority is to begin CPR if the patient is unresponsive and not breathing properly. Simultaneously, calling for assistance ensures that emergency responders are on the way. Option B is incorrect because leaving the patient unattended can worsen their condition. Option C is incorrect because if the patient is unresponsive and not breathing, immediate CPR is necessary rather than waiting to check again. Option D is incorrect because if the patient is unresponsive and not breathing, CPR should be started immediately. Question 22. Question on infection control. A patient with an infectious disease is scheduled for a medical procedure in a healthcare setting. As a medical assistant, what infection control measures should you follow to prevent the spread of infection to other patients and staff? A. Ensure the patient wears a mask and provide them with a separate waiting area. B. Perform the procedure as usual as long as the patient is not displaying obvious symptoms. C. Ask the patient to leave the facility immediately as their condition may cause a risk to others. D. Allow the patient to remain in the general waiting area but inform other patients of the potential risk. Answer A. Explanation. For patients with infectious diseases, proper infection control procedures are essential to prevent the spread to others. This includes providing the patient with a mask and ensuring they are seated in a designated waiting area away from others to minimize exposure. Option B is incorrect because even if the patient is not showing obvious symptoms, infection control measures must still be implemented to prevent potential exposure. Option C is incorrect because sending the patient home without proper treatment may not be the appropriate response unless advised by the healthcare provider. Option D is incorrect because allowing the patient to remain in the general waiting area could put other patients at risk of exposure. Question 23. Question on patient records. You are tasked with organizing patient records in the office. One of the records contains outdated information, and you know the patient's contact details have changed. How should you handle this situation? A. Update the contact information and notify the patient about the changes to ensure accuracy. B. Leave the record as it does not impact the current medical treatment. C. Discard the outdated information and make note about the change in the patient's chart. D. Alert the physician to handle the record change as it is outside your responsibility. Answer A. Explanation. As a medical assistant, it is your responsibility to ensure that patient records are accurate and up to date. Updating the contact information and notifying the patient about the changes ensures that the medical record reflects accurate data. Option B is incorrect because outdated information can lead to miscommunication or delays in treatment. Option C is incorrect because discarding outdated information is not appropriate unless you are following proper record-keeping protocols. Option D is incorrect because updating the patient's contact information falls within the duties of a medical assistant, not just the physician. Question 24. Question on professional boundaries. A patient who has been coming to the clinic for a few months invites you, a medical assistant, to attend their birthday party. What is the most appropriate response? A. Politely decline the invitation and explain that maintaining professional boundaries is important. B. Accept the invitation to build a rapport with the patient as it can enhance their experience at the clinic. C. Ignore the invitation and continue working without acknowledging it. D. Tell the patient you will consider the invitation but do not provide a direct answer. Answer A. Explanation. As a medical assistant, it is important to maintain professional boundaries with patients to avoid any potential conflicts of interest or ethical concerns. Politely declining the invitation ensures that the relationship remains professional. Option B is incorrect because accepting personal invitations from patients can lead to ethical dilemmas and conflicts of interest. Option C is incorrect because ignoring the invitation could appear unprofessional or dismissive. Option D is incorrect because leaving the patient uncertain can cause confusion and may breach professional ethics. Question 25. Question on blood pressure monitoring. You are measuring a patient's blood pressure and notice that the reading is unusually high. The patient is stressed about a recent personal issue. What should you do next? A. Take a second reading after the patient has had a few minutes to rest and calm down. B. Inform the patient immediately that they have high blood pressure and suggest lifestyle changes. C. Wait for the physician to check the reading before informing the patient. D. Refrain from measuring blood pressure again as the initial reading is likely inaccurate. Correct answer A. Explanation. Stress and anxiety can temporarily elevate blood pressure. It is important to take a second reading after allowing the patient to rest and calm down to ensure an accurate measurement. Option B is incorrect because discussing treatment or making suggestions without physician input may lead to inaccurate information being provided. Option C is incorrect because the medical assistant is typically responsible for recording vital signs, but further assessment may be necessary depending on the reading. Option D is incorrect because a single high reading does not automatically indicate a diagnosis and rechecking after a period of rest is important. Question 26. Question on patient privacy. A family member of a patient asks you for information regarding the patient's current condition. The patient has not granted permission for you to share this information. What should you do? A. Politely inform the family member that you cannot provide the information due to privacy laws and encourage them to speak with the patient directly. B. Disclose the information to the family member if they are the patient's legal guardian. C. Share the information with the family member if you believe it is in the patient's best interest. D. Ask the family member to wait while you check with the physician for permission to disclose the information. Answer A. Explanation. Under privacy laws such as HIPAA, patient information cannot be disclosed to unauthorized individuals, even if they are family members, without the patient's consent. The best approach is to politely inform the family member that you cannot provide the information. Option B is incorrect because even if the family member has a legal guardian, explicit consent is necessary for sharing information. Option C is incorrect because sharing patient information without consent could lead to legal consequences. Option D is incorrect because you should not disclose any information unless proper consent has been obtained, regardless of whether the physician approves it. Question 27. Question on blood draw. A patient is about to undergo a blood draw and they appear visibly anxious about the procedure. As a medical assistant, how should you address the patient's anxiety? A. Reassure the patient that the procedure will be quick and minimally uncomfortable and allow them to express their concerns. B. Ignore the patient's anxiety and proceed with the blood draw as quickly as possible. C. Tell the patient to relax as the blood draw is not painful and they have nothing to worry about. D. Offer the patient medication to calm their nerves before performing the blood draw. Answer A. Explanation. It is important to address the patient's anxiety by reassuring them, explaining the procedure, and allowing them to express any concerns. Common empathetic approach can help reduce their stress and improve their experience. Option B is incorrect because ignoring the patient's anxiety could cause unnecessary distress and affect the quality of the blood draw. Option C is incorrect because downplaying the procedure may not address the patient's feelings and could lead to miscommunication. Option D is incorrect because offering medication without proper authorization is outside the scope of medical assistant's role. Question 20. Question on handling medical equipment. You are preparing a patient for a routine procedure that requires the use of sterile equipment. After you open the sterile package, you notice that one of the items has a tear in the packaging. What should you do? A. Use the item anyway as it is, unlikely to affect the procedure. B. Discard the item and open a new sterile package. C. Attempt to sterilize the item yourself before use. D. Inform the patient that the item is damaged and ask if they want to proceed. Answer B. Explanation. Sterile equipment must be free from contamination to prevent infections. If the packaging is compromised, the item is no longer considered sterile and it should be discarded. You should open a new sterile package to ensure patient safety. Option A is incorrect because using an item with damaged packaging could lead to contamination and infection. Option C is incorrect because attempting to sterilize the item is not a reliable method to ensure sterility in a clinical setting. Option D is incorrect as informing the patient about a damaged item is unnecessary. Replacing the item ensures the procedure is done with sterile, safe equipment. Question 29. Question on patient education. A patient has been prescribed a new medication to manage their chronic condition. They seem confused about how to take the medication and ask for clarification. As a medical assistant, how should you respond? A. Provide a detailed explanation of how to take the medication, including dosage, frequency, and potential side effects. B. Tell the patient to refer to the instructions provided with the medication, as you are not qualified to offer any advice. C. Offer the patient a written list of instructions and recommend that they call their physician if they have questions. D. Explain the medication briefly and suggest they look up more information online. Answer A. Explanation. As a medical assistant, part of your role is to educate patients on how to take their medications correctly. You should provide a clear, detailed explanation that covers dosage, frequency, and possible side effects to ensure patient safety and adherence to treatment. Option B is incorrect because as part of patient care, providing clarification and instructions is part of your responsibility. Option C is incorrect because while written instructions are helpful, patients may need verbal clarification, especially if they are confused. Option D is incorrect because offering advice to look up information online may cause confusion or lead to incorrect self-diagnosis. Question 30. Question on cultural sensitivity. You are assisting a patient from a culture that has specific dietary restrictions related to their medical condition. They are hesitant to discuss their dietary preferences and are uncomfortable when asked about their eating habits. How should you handle this situation? A. Respect the patient's cultural beliefs and offer a referral to a nutritionist or dietitian who can better address their needs. B. Insist on getting detailed information about their diet to ensure that their condition is properly managed. C. Avoid discussing dietary restrictions altogether, as it may make the patient uncomfortable. D. Inform the patient that their dietary preferences may not be compatible with their treatment plan and proceed with the necessary instructions. Answer A. Explanation. Cultural sensitivity is essential in healthcare, and respecting a patient's beliefs and preferences fosters trust and cooperation. If the patient is uncomfortable discussing their diet, referring them to specialists like nutritionist or dietitian ensures that they receive accurate, culturally appropriate advice. Option B is incorrect because pushing the patient to disclose information they are not comfortable sharing can damage the therapeutic relationship. Option C is incorrect because dietary considerations can directly impact treatment and avoiding the topic may hinder effective care. Option D is incorrect because imposing dietary restrictions without understanding the patient's preferences may cause resistance or discomfort.